Okay, thank you for coming today to the first installment of our lecture series at MCRC Physical Therapy. My name is Eugene Katsnelson. I'm a doctor of physical therapy and I've been practicing outpatient orthopedic physical therapy for 10 years in Bergen County, North Jersey area. Today's presentation is going to be about the athlete's shoulder and we're going to discuss a couple things. Number one, we're going to discuss the anatomy of the shoulder itself. We're going to discuss common injuries that happen to the shoulder. We're going to discuss different risk factors that can maybe predispose you to shoulder injury. And we're also going to talk about ways to prevent shoulder injuries from happening. And more concentrate towards weightlifting and exercise because we are in a gym environment here in Strive Health and Fitness. So the first thing I want to talk about, since we're talking about the athlete's shoulder, we're going to talk about the athlete's part. And what is an athlete? To find that out, I Googled it, and what I found is that it's a person who is trained in or good at sports, games, or exercises that require physical skill and strength. A lot of times when we talk about athletes, we think about Olympic athletes, professional athletes, but I like to treat all my patients as if they were athletes because in a way, we're all sort of athletes because we use our bodies all day, especially our shoulder, in a lot of different ways that require a lot of lifting, repetitive activities, and a lot of different stresses that we put on it on a day-to-day basis. First thing we're going to talk about is the anatomy of the shoulder. And a lot of times when we think about the shoulder, we just really concentrate more on the ball and socket joint of it. But in reality, the shoulder consists of three different joints. You have the glenohumeral joint, which is the ball and socket. You have the AC joint, which is the acromioclavicular joint, which is the clavicle coming together with the scapula. And then you have the scapulothoracic joint, which is the scapula, which is your shoulder blade, sitting on the thorax, which is your rib cage. So let's break that down. The first thing we're going to talk about is the glenohumeral joint, and that is that ball and socket joint that we all know and refer to as shoulder. As you can see in the picture here, it's very mobile. It's got 6 different directions of movement: rotation, flexion, extension, abduction, adduction, and it's great because it allows us to do a lot of different things, but at the same time, it's very unstable and inherently very unstable. The way that it actually more is like to a golf ball on a tee. So the ball of the socket is much bigger than the actual cup that it sits in. And it makes it very unstable, and a lot of different things need to work together in order to keep that ball on the tee. So seeing that illustration there makes you appreciate kind of a little bit more what it's like and why there's so many types of injuries that can happen to the shoulder when that balance isn't really there 100%. The other next thing I want to talk about is the cartilage, which is a smooth covering that covers all our joints. And of course we have that also in the shoulder, which we have cartilage that covers the ball part and cartilage that covers the socket part, as you see here, which is called the glenoid. And the labrum is one of the things that we hear a lot about in people tearing labrum or injuring the labrum, and that's part of the cartilage of the shoulder. The next thing is the ligaments and capsule, and the capsule is soft tissue that surrounds the joint and makes like basically a capsule around it. And there's thickenings in the capsule that we call ligaments, which are tighter bands, and that gives the shoulder stability and a kind of like tight ropes that hold everything in place. And of course you have muscles, and there's a lot of different muscles that surround the shoulder. Some of them are shoulder blade muscles, and the ones that kind of come from around the back, and your biceps and your triceps, all kind of around that shoulder area. But the most popular ones that we always hear about are the rotator cuff muscles. The rotator cuff muscle is a group of 4 muscles that is the supraspinatus, subscapularis, infraspinatus, and teres minor. And what the main job of the rotator cuff is to kind of try to work together. The 4 different muscles come from 4 different directions, and they come together to hold that ball in the socket. As you move the shoulder, it makes sure that that shoulder is centered in the socket to make everything work perfectly.